that page with you or
No,
something?
no, no, no.
Okay,
Yes, we'll be going live now. I'll be telling
okay,
you
sure.
just in 2 minutes only.
Yeah,
Yeah, it's live now. We can start.
Hello, good evening, everyone, and thank you for taking out the time and joining us. Today we have with us Dr. Ami Shah, who's done her pediatrics and then done her fellowship in clinical genetics, and is currently working at Nanavati Hospital and also has attachments at Surya and Wadia Hospital. And it was really kind of her, and she was really excited when we told her about this, that we at Saarthi wanted to discuss about this topic of genetic counseling in a way that it will help all the other fellow siblings to take their life decisions. So, ma'am, without wasting any much time, I'll please ask you to start with the discussion.
sure. So I think we decided we'll have a short presentation. So can I share my screen now?
Yes, ma'am.
Okay, I think it is coming host disabled participant screen sharing.
Okay, ma'am. 1 minute.
Hmm. Yeah, the option is not coming to share the
Mm,
screen.
no. Okay, now it's there. It's there.
Yeah.
Yeah.
Yes.
So while I'm just starting my presentation, I would like to say that, the initiative that you've started is just amazing. This is something which should have started, long time back. And I'm surprised how none of us really started it. But I'm happy that, it's being done by the siblings for the siblings. And it's a great initiative. So kudos to y'all. And I hope, y'all keep on going, and definitely whenever you need any of our help, whether it's me or my colleagues, I'm sure all of us will be ready to help you. So, my name is Dr. Ami, and I'm a clinical geneticist. And to start with, since we are just a week from Diwali, I hope everyone has had a happy, healthy, safe Diwali. So what I'm going to do in my presentation is just give an overview of what a geneticist does, what are genetic disorders, what is genetics, and how it can impact neurodevelopmental disorders, especially intellectual disability being the focus for today, and how that can help you for your screening, and when you're trying to or planning to get into marriage, then how does it impact you? So just to start off, this is how I tell all my patients that just like how a building is made of bricks and stones, in the same way, our body is made up of multiple cells. So in Hindi, a lot of people know कि सफेद पेशी लाल पेशी होती है blood में. वैसे ही there are multiple cells all over the body. Each part of our body is made up of cells. And as you can see, this is a cell. There is a headquarter or a center of the cell, which gives instruction to the cell as to what is to be done. And the workers who are there in this headquarters is what we know as the chromosome, or that is a genetic material. So just to make it even more clear, so you have a cell, there is a nucleus or the headquarter, and in that you have these chromosomes or the genetic material which is there, which basically are is our fate for the rest of our lives. And that decides everything that we do, the way we look, the way we smell, the color of our eyes, everything is dependent on that. So just to expand on that, the chromosome is like a bundled up thread which is there, and generally there are two pairs. So you can see this is one and this is two. And if you start unwinding that thread, this is what you will ultimately get, which is what we know as the genes or the DNA which is there. And like you can see, if you look closely at it, it is made up of only four alphabets, that is A, C, T, and G. So just the four alphabets, just like English language is made of 26 alphabets, our genetics or gene language consists of only four alphabets. And the arrangement of those four alphabets in the entire gene is what actually decides how our body is going to function. Now, depending on where the defect is there. So basically, if this is the gene, any abnormality at any point will give you a genetic defect or a genetic abnormality, which will obviously result in a disorder, which we see, as multiple things. Whether it's intellectual disability is definitely one of the things, autism, it can be other neurodevelopmental conditions, liver problems, multiple problems which can be there. So just to give you a fair idea, there are obviously a lot of different types of genetic abnormalities that can occur, but there are two basic types which I would like to just touch upon. One is when it is at the larger chromosome level, you can have duplication or reduction of the number of chromosomes. So, like I said, each of these 43 chromosomes which you see, like you can see, they are very nicely numbered over here, are actually in pairs. There are two of each. So, if those two, the number increases to three, like you can see in this picture, or if there is a reduction, so instead of two, there is only one chromosome which is there, then it can result in a genetic disorder. Another variety is, like I said, that ultimately the genes are made up of four alphabets and how they are arranged. So if that arrangement is hampered in any way, either it can be because, like you can see, there is one gene which is getting inserted, or one gene or one alphabet which is being removed, or the alphabet is being replaced by a different alphabet. So just like in English language, a single alphabet, if you change, say in CAT, cat, if you remove the A, it just becomes CT. Or if I change that A to CTT, the meaning of the word changes. In the same way, in the genes also, a change of a single alphabet can cause a genetic abnormality. So now coming to, your group is focused on siblings of intellectual disability. So I thought that, from my side, I should talk a little about intellectual disability, because that is what is ultimately going to help for the counseling and for the screening also. So now, maybe most of you all would know that intellectual disability is sub-average intelligence with impairment in the adaptive function. Most important thing is that it should begin below 18 years of age. So any person who's absolutely normal till 18 years and then has any difficulty in terms of the intellect or adaptive function, it will not be classified as intellectual disability. We also have an IQ score as a deciding factor, which I should tell you can only be applied after 5 years of age, because the testing material is applicable for only 5 years and older. So below 5 years, we cannot do the IQ, and we technically cannot classify them as intellectual disability unless the IQ score is below 70. And in the entire population, we would have about 1 to 3% who would have some or the other form of intellectual disability. Now, when I said it is sub-average intelligence and impaired adaptive functioning, it does not actually restrict to that, but there can be multiple other domains or areas which can actually be affected in intellectual disability, which includes things like conceptual, that's your reading, writing, understanding, social domains where interpersonal relationships are there, and practical, just self hygiene, going to a shop for buying something, organizing yourself. So any or all of these domains can be involved along with the impaired intellect and the adaptive functioning. Also, like I was talking of domains over there, we normally in neurodevelopment consider four domains to be there. So there is cognitive skills, there is social skills, there's communication, and the one which is missing over here is actually motor skills. So depending on which skill is affected, you have different neurodevelopmental disorders. So there is something some of you might know, there's something called as a DSM criteria, which divides these or classifies these neurodevelopmental conditions. So in that, if you majorly have cognitive skill which is impaired, with or without the social skill and the communication being affected, then you have what is called as the intellectual disability. But you should also remember that there are other neurodevelopmental conditions which can mimic intellectual disability and are not actually intellectual disability. An example of that is autism spectrum disorder, wherein the social and communication skills are much more affected than the cognitive skills. In fact, you can have someone who is into the spectrum with absolutely normal IQ as well. Also, there are, like I said, other neurodevelopmental conditions which can be misunderstood as intellectual disability, like attention deficit hyperactivity disorder, communication disorders, and motor disorders, especially cerebral palsy. So, when we are thinking of screening, when we are thinking of genetic counseling, it is very important to determine where one person falls into in terms of their neurodevelopmental uh, condition. And the most important thing is developmental delay. Now you can have a lot of children, like I said, intellectual disability cannot be diagnosed before 5 years because we don't have sufficient testing for that. But you can predict intellectual disability, and one of the most important things which generally appears earlier is the developmental delay, which can be in all of these domains. And there. So, you can have developmental delay in children below 5 years of age, and that might be a red flag for an eventual neurodevelopmental condition or a developing neurodevelopmental condition. Also, important to understand that intellectual disability is not really the diagnosis. So it's ये कोई बीमारी नहीं है. This is just a symptom. मतलब बीमारी का लक्षण है. So the underlying condition or the underlying problem can be multiple or can be different, but they all can have intellectual disability as a symptom. So, just to make you understand that when I think of intellectual disability, these are broadly the four, underlying causes that I would think of. One is environmental, that includes, injuries just before the birth or during the birth or after birth. Then infections, which are there, like rubella and toxoplasma, or you can have any structural abnormality in the brain which can give intellectual disability and other neurodevelopmental conditions, or you can have genetic, which is what we are trying to focus on. In genetic also, there are multiple different types. Some of them are, like the two situations that I showed you in the very initial slide, where there can be increase or a reduction in the number of the chromosomes, or it can be a change of the alphabet, that is a point mutation. You can also have something called as metabolic disorders, that is when there is a genetic change. There can be some change in the chemicals of the body, like the hormones and the proteins, which can eventually result in other conditions, and one of that can be intellectual disability. So, when we are talking of genetic screening and counseling, the focus is more on genetic and structural defects because infection and environmental are not inherited. So, the recurrence risk will be highly unlikely in case it is environmental or infection. But if we are suspecting a structural abnormality or if we are suspecting an underlying genetic abnormality, then you need to think of genetic counseling and genetic screening. So, like I said, you should not mix intellectual disability with other neurodevelopmental conditions. At the same time, you can have a child with intellectual disability with other neurodevelopmental conditions associated with that. Like you can have sensory deficits only, you can have language and communication problems, you can have seizures, fits जिसको हम बोलते हैं. Then you can have cerebral palsy. जैसे मैंने बोला कि cerebral palsy is a condition which is basically environmental cause of intellectual disability, wherein either just before the birth, during the process of delivery, or immediately in the first few days of delivery, there is some defect or some problem which happens which affects the development of the brain. So cerebral palsy is a static condition. It does not progress, but it can have intellectual disability associated with it. You also have autism spectrum. Just like I said that someone with autism can have a band normal IQ. At the same time, you can have someone with autism with a IQ which is below 70. And this is the most important thing. Whenever we are suspecting genetic abnormalities, what we are looking for, especially for the number change that I told you about, we are looking at dysmorphisms or malformations. Like here you can see that there is a cut in the lip of this child that is called as a cleft lip. You can see the abnormality of the fist that is there. You can have a ear which is abnormal, or you can have multiple other signs which generally a specialist would understand, which will give you an idea of an underlying genetic cause. So these actually will be clues as to how we diagnose the person, and that would ultimately help also in the counseling and screening of family members. So coming to today's question, so the reason why I was called or what I was told is that you as siblings of patients with intellectual disability would like to understand at what sort of a risk are you all there of having a child with a similar problem, and to help you all answer questions of your probable partners when you are discussing a marriage proposal. So, when we are talking of recurrence risk, the most important thing is to identify the cause of the problem. So, if you have a sibling with any of the neurodevelopmental disorders, and I'm generalizing because it's possible there are a lot of people who watch it on Facebook who may have other conditions other than intellectual disability. So, this is a, a bit general, but you need to understand that you need to know what has caused that problem, and only then can we counsel the other family members. Unless we know what the problem is, we cannot give you a recurrence risk. Also, like I said, there are certain conditions which are not inherited, like infections, like defects which happen due to injury during birth. Then they will come into non-genetic conditions, and obviously the recurrence risk in that case is extremely low. I would say it would be 0 to 1%. But if it is not any of those conditions, and if we are suspecting a genetic disorder, then ideally we would like to have a defined disorder. So we would like to diagnose the person who's affected before we counsel others about it. Rarely it can so happen that we don't have the scope to do that, or that we have used all the tools that we have and still not be able to diagnose. So you can have two situations where you have a defined condition and you have an unknown condition. So just to give you an idea on how we evaluate from the genetic perspective. So any child with intellectual disability, or for that matter neurodevelopmental condition, obviously the basis of everything is history, wherein we will take the birth, development, बच्चे को क्या तकलीफ है, family में और किसी को तकलीफ है कि नहीं, whether there is in consanguinity, that is whether parents or couples are married within the family, so marrying your second cousin or third cousin. So all these points become very important when we are suspecting a genetic condition. All of these will act as clues to that. And at this stage itself, at times we can rule out, because say if we come to know that there is some problem which happened during birth, the child did not cry, received less oxygen, had some sugar related issues, immediately post delivery, then we know that this is less likely to be genetic, and it helps us in counseling the parents. Next, obviously, we need to examine the person who's affected. So we look at growth. So you can have things like short stature, which will give you an idea of the underlying condition. What sort of a behavior is there? Sometimes you have children who have, self-mutilation behavior that can give you a clue to certain disorders. What sort of a delay? Like I explained, there are 4 domains which are there. So how each domain has been affected, and obviously physical examination to see whether there is any other organ system which is involved. So generally more than one organ system involved, again, we are thinking of a different underlying condition. Then obviously we go to investigate. So depending on the history and examination, generally a doctor will have a fair idea as to what and where we are heading. And depending on that, he will generally formulate an investigation list. Broadly, it would need a psychological evaluation. Obviously, like I said, you want to make sure you know which area of neurodevelopmental disorder is the person falling into. So, you know, you can do IQ, there are tests to detect autism spectrum disorder, tests for learning disabilities, tests for ADHD, and each of them will help to understand and, you know, help in evaluation. You also do ophthal and hearing for all patients who have a neurodevelopmental condition for two reasons. One, definitely it gives a clue, you know, whether I would, you know, which condition I'm suspecting, but at the same time, it will also, you know, if any of these are affected, it is going to bring down the intellectual capacity of the person. So to make sure that is not what is contributing, you need to do these. You also have neurological examinations like EEG and MRI to help and see, you know, what exactly brain abnormality is, whether there is any electrical abnormality. MRI will give you an idea about the structure of the brain. And obviously there will be some or more than some sometimes blood investigations which are advised. And depending on all of these three, you will ultimately have, you know, come down to a very few or maybe sometimes rarely a single suspected condition. And just to confirm that, you may have to do some further tests, which includes a genetic test and a metabolic test. So metabolic tests are, again, you'll be checking for the chemicals which you're suspecting it to be abnormal. Genetic test is the ultimate testing that we do. Now, just to give you a quick idea about genetic testing, because there are a lot of misconceptions for that. So, when we are talking of genetic tests, just like other tests, there are multiple options which are there. And those options are not obviously to be chosen randomly. They are not to be chosen in terms of how much the cost is and how much one can afford. But it actually depends on what sort of a genetic condition we are suspecting. So just like I showed you in the first slide, if we are suspecting a numerical problem, which is generally much larger, where we are suspecting one chromosome to be duplicated, so there are three in for one particular number, or there is a reduction, then you can do something called as a karyotype or a fish. Now, when you go further, so if it is not something which is easily visible, if it is much smaller but still a numerical problem, then you go for the second test, which is called as an MLPA or array. And you have further testing where I said, you know, that if there is a single alphabetical change, then you go for the third tier of testing. Now, it is important to remember that all these three tests will detect different abnormalities. So it is possible that if one has a genetic condition, it can be missed in a karyotype if it is a much smaller condition, because it does not pick up smaller changes. At the same time, if you have an alphabetical change, so spelling mistake अगर है, तो वो ये दो टेस्ट में पिकअप नहीं होगा. You will have to be doing sequencing test. Same way, there are other tests which are there for certain specific conditions which can be missed by all three. And one of the examples, which, since we are talking of intellectual disability and which you might have heard of or you might know, is called as Fragile X syndrome. So Fragile X syndrome will not be picked up by any of these three, and you will have to do a specific test for Fragile X syndrome. And the reason why this happens, that's why it is very important that you go to the correct person and get the person affected evaluated, because that will help us to decide what genetic test is to be advised, which will give us the best possible outcome. Also, you need to know that all these genetic tests that we do are actually based on the information which we have so far. So all the data that we get from these genetic tests, they are actually evaluated on basis of a database. So basically, in the last so many years, since we know about genes and DNA and chromosome, we have been accumulating information about conditions and what exactly their genetic problem is. So the results which come are on basis of that database. Now you need to understand there may be times. I think there was one question which Soumya had forwarded to me. Whether genetic testing results can change over a period of time. So you need to understand that as of today, whatever the database has, that will be screened. But if for some reason there is a new condition or a new abnormality in the genes which is detected, say even 10 days from now, that will not be detected in the testing that you do. And that's why sometimes it is possible that someone who got a negative report, say 10 years back, can go on to have a positive report 10 years later if the person is retested. So a lot of times when we have a very strong suspicion and the reports have been negative, we may advise for reevaluation a few years down the line. If until then we've not been able to answer that query. Now coming to the main question that we were discussing, what is the risk? So there was this paper which was published. It's an Indian article, and they discussed the empirical risk. मतलब एक तरीके से हम बोल सकते हैं कि अंदाजा लगाया है depending on whatever studies have happened so far for children who are affected with intellectual disability and what is the risk of their siblings being affected. So I'm just going to give you an overview. Please do not generalize. All the patients, all the people who are affected will in themselves be unique depending on the family background, environmental background, depending on the condition which is there. But like I said, sometimes despite utilizing all the tools that I've discussed earlier, we may still not have an answer. And in such cases, we will probably give you an approximate risk, which you can sort of use for yourself. So now if you have parents who have one affected child, then the risk of either a male or a female sibling to have the similar condition, intellectual disability, and mind you, I'm talking of severe intellectual disability here, which we define as below IQ below 50. So in such cases, with one affected child, the risk to a sibling, whether male or female, would be 1 in 35 chance. At the same time, if we are specific and we say it is the male sibling, then the chance is 1 in 25. But if it is a female sibling, the chance is 1 in 50. So in this case, the females have a slightly better chance because we know that there are certain conditions which cause intellectual disability, which affect the males more than the females. And if you are consanguineous, like I said, if your parents are married within the family, then the risk is 1 in 7 of having an affected child. Now, I know that we are talking of siblings, so we are talking of how your children would be affected and not how you would be affected. But like you can see, you have to understand that there might be some genetic material which may be inherited at times, and that is how this risk is calculated. So a second example is when the parents have either a male or a female, two children who have intellectual disability, then any, a sibling, which is male or female, has 1 in 4 chance of having a similar genetic abnormality in them. And if you have parents with an affected child, in whose case the mother's brother is also having some similar condition, then the risk of having that particular genetic abnormality in the male sibling is very, very high. That is 1 in 2 chance. But in females is extremely low. So I think there was another question which was asked, something to do about, if my mother's side there is a positive family history, how far I would be affected. So certain times, certain conditions, yes, the risk to a male, with similar family history would be slightly higher. But if the male is absolutely normal, so if the sibling is absolutely normal, then generally you don't need to be concerned about it. And if you have a parent and a child who is, abnormal, then the risk is 1 in 5. Now, this I've given just an empirical risk. Again, I'm saying this is not a hard rule and it keeps changing depending on the situation and the condition that we are suspecting. Now, if I have a confirmed disorder which I detect, which is a genetic abnormality, like I said, non-genetic, the inheritance or the chance of risk to your siblings is extremely, extremely low. But when I'm talking of a genetic condition, then there are certain situations where the risk of you as a sibling having that genetic abnormality would be 1% or lower, but the range I would give you is up to 50%. So there are certain conditions which either you may inherit and you may show some features of it, or you may not really show any features but be carrying some genetic material. And that's why the risk is so wide. So coming to, like I said, risk to your children. So obviously, as a sibling, if you have a brother or a sister with intellectual disability, like I said in the very beginning, the risk to your children will depend on whether the defect in your sibling is genetic or not genetic. Like I said, if it is not genetic, then the risk is extremely, extremely low. But if we are thinking of an underlying genetic condition and considering that you are absolutely normal, then there are chances, like I said, of 1 in 4 to 1 in 50% chance that you might be carrying an abnormal gene but not showing the condition. And in such cases, obviously, there is a risk that you would be passing it on to your children after marriage also. And if it is non-genetic, in the sense, we are not sure, or we've not been able to delineate whether it is non-genetic or genetic, then obviously it becomes very difficult to know. Like I said, it is important to diagnose the person who's affected before we get into counseling for siblings. So obviously, one advice that I normally give to anyone who has an underlying genetic abnormality in the family is please avoid marriage within the family. So that includes second cousin, third cousin. In the Hindu thing, you have the concept of gotras, which is sort of related to genetics. Gotras of the same family will be same, and that's why people tend to avoid marrying into the same gotra. And like this is the most important thing, and I've been harping and will go on harping that it is very important to diagnose the person who's affected. Unless you know the answer to that, you will not be able to help yourself with the genetic counseling and to understand the recurrence risk. Also, lastly, who should undergo genetic counseling, when should they undergo genetic counseling, and where? So obviously, first, like I said, it's right at the beginning when you have anyone who's suspected, to have an intellectual disability, then that person, along with the parents, would have to undergo genetic counseling. Siblings, normally, we would say, after they have entered adulthood, because then they become they can take their own decisions, and that's when we bring in the siblings. Rarely if it happens, that the condition can have some other symptom or medical abnormality in people who have part of the gene, then yes, we do screen the siblings much before 18 years of age. But that's in very, very rare instances. So generally we would advise, for the siblings to come into picture once they are adults. So when do you do genetic counseling? Like I said, the first suspicion of a genetic condition, you should do genetic counseling, and obviously prior to testing to understand what exactly you're going to undergo and what results are to be expected. Post testing to discuss the test results and how it is going to affect the person, the child, and how it's going to affect the family first and beyond. And obviously siblings before testing and premarital, if they wish to, they can opt for genetic counseling. Where should you do genetic counseling? Obviously it has to be in specialized centers. Now, unlike say 5 years or 10 years down the line, we have a lot of us around, in fact in Mumbai city, in fact all over India, though they are not as much as the other medical fields, but we are slowly increasing in number. So please try and go to a center which has a geneticist there to discuss your case. You also have centers which may have genetic counselors, which is also okay because they can also guide you for the testing part. Rarely, when it comes to management and treatment, then they may refer you back to a geneticist. And if none of these are available, if you are at a very small center, then at least consult your neurodevelopmental specialist about your concerns of it being genetic, about it affecting you as a sibling, and about the risk uh, that you may have of passing it on to your children. So just, before I end, I would just like to summarize. Most important thing to understand is intellectual disability is a symptom. So वो एक लक्षण है, जो एक्चुअल तकलीफ है वो अलग है. सो जब भी हमको काउंसलिंग करना है या इस चीज का इलाज करना है, मोस्ट इम्पॉर्टेंट थिंग इज दैट यू हैव टू फाइंड द अंडरलाइंग कॉज. अंदरूनी तकलीफ क्या है उसका पता लगाना है. Intellectual disability, autism, or any other symptoms, as I say, are just an indicator of what is going on inside. Also, it is important to know you can either have intellectual disability, which is just by itself, which can still be genetic, or you can have it in combination with other conditions, like I explained. And again, just before going, the most important thing is find the cause. You cannot go beyond if you do not have the cause. If the cause will help you to give a closure as to why it happened, it will obviously put an end to the diagnostic odyssey, because at least you have an answer. And once you have the answer, the management becomes much more easier. Generally, genetic conditions, there are very less treatment options which are available, but yes, I would say, for about 5% of genetic conditions which result in intellectual disability, there might be some treatment options which we can give, which can be very, very significant. Rarely, if it is not available, then at least the supportive management and what all other problems that you need to look for. Like I said, sometimes it can happen with other organ systems being affected also. So that is what it will help. And obviously, the main question for today also requires you to know the cause of the problem in your sibling. Without that, we cannot offer counseling. Generally, we cannot obviously give you any benefit for, post marriage for the reproductive plan. So it is important to find the cause in the affected child. So Soumya, thank you so much. I've just put this slide as the contact points. My email ID is
Yes,
there,
ma'am.
so if anyone wants to connect with me, they can do so by just putting in a mail, and I will definitely try and respond as soon as possible.
Thank you so much, ma'am. It was really very informative, and it was presented in a very lucid manner so that we all could understand the
I
basic
hope
points of
so.
it. Ma'am, just a few questions which
Sure.
have come through. So,
Yeah.
one question was that are there any specific genetic tests for autism?
So, like I said, there are multiple testing options which are available. Now, as geneticists, we have our own protocol. So, say when we are suspecting autism spectrum disorder,
Yeah.
we may use those protocols to decide on which test to opt for first.
Yes. Yes.
Sometimes it can happen that despite following the protocol, you may not really get an answer with one test, in
Hmm.
which case you may have to go for further genetic testing. So like I said, if I can go back on my slides, I don't know if it is visible. uh, yeah. So, like I said, depending on where the defect lies, the test is decided. And each test will have a very specific thing which it finds, which generally the other tests will not be able to detect. So sometimes that's the advantage of going to a specialist or a geneticist, because they will know, or they will suspect, say, XYZ. Like if I suspect fragile X, then none of these tests will give an answer. The only test, which is useful, is called as PCR, in which only the fragile X gene is going to be detected. But say if I'm suspecting someone to have fragile X, and I do the PCR and the PCR comes negative, then I start thinking that probably it's not Fragile X. So I need to look for other causes. So I may want to advise further genetic testing.
Hmm.
So just to come back to your question, yes, there are certain specific tests out of which we choose for an autism spectrum disorder to do first, but that can change depending on what associated findings the clinician may find. So if you're suspecting a specific condition or a disorder, you will obviously do a more specific test. If you cannot suspect an underlying condition, then there will be a generalized test which will be applied.
Okay, ma'am. So I got it. Basically, so it has to do with the other signs and symptoms that
Correct.
the patient
Yes.
has and
Yes.
directed towards the specific question which needs to be answered.
Right.
Yes.
Yes.
Another thing is that if suppose like my brother is autistic and if I decide to go ahead and start a family, so
Right.
do me and my future partner need to go ahead for genetic counseling or is it not needed?
So, like I said, you can have autism which is based on environmental factors rarely, or on non-genetic factors, or
Yes.
genetic factors that we are still not aware of. In that case,
Yes.
obviously, there is no point in testing either you or your partner. So,
Yes.
if you do come to, so you can always go for genetic counseling. Okay, so
Yes.
there is, you don't need to have a reason for it. If you have any sort of a suspicion, I'm
Yeah.
sure me and my colleagues will be more than happy to guide you through that.
Yes,
But
ma'am.
the point is whether there is a risk or not will depend on the underlying cause. So,
Yes.
if I have to give you a risk as to what are the chances that, your child would be affected, I need to first diagnose your brother.
Mm.
After I diagnose your brother, I would be looking first at your parents. So there are times when the parents are not really affected, but it is just one child who's affected. Then again, the risk of that same genetic problem recurring in the sibling is very, very, very low. So generally,
Yes.
we test the patient and then we test the parents if the patient is positive. And
Mm.
depending on the parents' status of the genes which are affected in them, we can give you a risk ratio for you to be carrying a part of it, and for you to, what sort of a risk you would have to pass it on to your child.
Yes, ma'am. If I understand correctly, the risk of my future offspring would depend on the cause of my
Correct.
sibling's disorder.
Yes, absolutely.
Yeah, so it cannot be generalized per se.
Generally, no.
Yes, yes. Okay, ma'am. I think that's all the questions they were there. Rest of all
Sure.
have beautifully already taken care of during your session. I'll
Yes,
just give the
I
audience
tried
one
to
more
make
chance.
it. I just tried to make it, as easy to
Yes,
understand, because
ma'am.
it's important to understand the whole process.
Yes, ma'am.
When you go for genetic counseling, this is
Yes.
something which we would discuss with every patient who comes for genetic counseling.
Yes. Yes,
Yeah.
ma'am.
Ma'am, there was a question. Sorry to interrupt.
No, no
Uh,
problem.
how do we check probability of second child to be on spectrum with no family history?
So, like I said, even with no family history, rarely, initially there used to be this panda ke, genetic problems are only there if you have more than one family member who's affected. So they would say कि हमारे family में तो किसी को ये तकलीफ नहीं है, पता नहीं इसको क्यों हो गया. So, that assumption has changed now. We know that there are times where, you may have absolutely no affected member, or you can have people who have minor issues which actually go unnoticed, but the major issue has happened in one child only. So we come back to the same thing, that you need to diagnose the person who's affected to know what is the risk in the second child which is there. So anyone who would come to me with that question, the first thing that I would ask them to do is you have to diagnose the affected child. Unless you diagnose the affected child, I may be able to give you an empirical risk. मतलब अंदाजे से, like I said, if there are no family members affected, the risk can be as low as 1 in 50 also. But like I said, the ideal way to do it would be to diagnose the person who's affected, and that would make things much, much easier for counseling for the next child and for counseling the sibling also. Yeah.
Yeah. Thank you.
Thank you,
Okay.
ma'am. I think it's answered all the questions. And thank you so much, even in my mind. And I hope it's the same with the audience.
Yes,
And
I
I
hope so
hope
too.
all of us are much better informed to take our decisions.
Yes, at least I feel, there is this slight information which I've passed on. Even if
Yes.
people have not understood, 50% of it, I'm okay. At least it will give them an idea. Okay, genetic condition क्या होता है, genetic
Yes.
counseling क्या होता है, because we know that the moment we suspect a child of a genetic disorder and we advise genetic testing, we never see them back, because there is this real bad fear behind it. So I hope I've been able to remove that fear, and I hope that more people would opt for this wherever obviously it's applicable, through the right source and the right person.
Yes, ma'am. Yeah. Thank you so
Okay.
much.
Thank you,
Yes.
Soumya, and
Thank
thank
you.
you, Prashant. And I just hope that you continue doing the good work that you all are doing, and that you all
Yes.
help as many people as possible. And I hope that whenever you need me, I'm able to, help you back as well. Okay.
Yeah.
Thank you so much, ma'am.
Yes.
Thank you
Thank
so
you so
much.
Yeah.
much, ma'am. Take
Okay.
care. Yeah.
Bye.
Thank you so
Bye.
much.
Take care.